Good afternoon, good morning, good evening, wherever you are. Thank you for joining the Link family for episode 10 of our Aging and Elderly series. We've come a long way and we thank God for how much He has helped us in this series. Today, we are going to be talking about lifestyle health and eye health in the aging. And it's going to be a wonderful time. We still have a lot of time to invite our friends, our family, our co-workers, and everyone, in fact, because they're going to find this session immensely beneficial. So whoever is not elderly is aging, and that includes all of us. So tell them to join the Zoom link and tell them that they should also join on the YouTube channel if for any reason they have any difficulty joining the Zoom. And so without much ado, I'm happy to let you know that our speakers for today are in the house and they would be coming up shortly. We're going to have Dr. Modupe Ijadola, who is a consultant ophthalmologist, and he will be speaking to us first about eye health in the aging. And afterwards, we are going to be having Dr. Shola Fatola, and she's going to be talking about lifestyle health in the aging. And she is a consultant general practitioner with a special interest in lifestyle medicine. And so we are going to have Dr. Modupe Ijadola first, and he's going to be talking to us for a short time. After that, we are going to have Dr. Shola Fatola, and she's going to talk to us briefly first for about 15 minutes, going to take a short break in between when we are going to introduce the Link family, which is just going to be about the 5:30 mark. And then after that, she's going to come back, complete her session, and then we are going to have the opportunity to ask both of them questions. Thank you to everyone who has joined us. I can see people from South Africa, Estonia, Denmark, the United Kingdom, Canada. Thank you so much, and Nigeria. Thank you for joining us. Okay, so I am going to just call on Dr. Modupe Ijadola. And he's going to come on the screen. Dr. Ijadola, you can put on your camera. No, don't share your screen just yet. Just put on your camera first. Don't share your screen just yet. Please put on your camera and I will just put you on the screen first. Okay. Okay. Put on your camera. No, don't share your screen just yet. Just put on your camera first. Just a minute. I can't see you so clearly. You might need to lean back. Yes, more like it. Sure, he's going to say I'm disturbing his life, but yeah.
Hi.
Hello. Just 1 minute. Yes, just going to go through a brief intro for him now. Okay. Yes, so we have Dr. Modupe Ijadola. He graduated from the Premier University, the University of Ibadan College of Medicine in 2006. He happens to be my classmate and is a good friend. He's also a member of the Link family. He trained in ophthalmology. He's a specialist and a fellow of the West African College of Surgeons. In 2017, he's also subspecialized in retinal surgery, and he has over 20 peer-reviewed articles. And he is currently working in the University College Hospital. He's happily married and resides with his family in the ancient city of Ibadan. Join me to welcome Dr. Modupe Ijadola. Okay, I hope you people know how to show love, eh? All right, you can share your screen now. You're welcome. Thank you for joining us.
Thank you for inviting me, Tammy. In just a minute. Can you see my screen now?
Yes, we can see your screen now. You can go ahead. Thank you.
All right. All right. Okay, good evening, everybody. Thank you for this opportunity to talk to you. I have a short time. Timmy give me just 15 minutes, so I'll try and be as brief and straight to the point as much as possible. So this
You
evening we're
can
talking
have two
about
minutes of grace afterwards.
progress. All right, thank you. I'll be talking really about the eye health in the aging population. So who are the aging population? Of what aging population, our parents, our grandparents, our teachers, our neighbors, our loved ones. I'll just say that many of us have very close ties to people who are in that aging bracket. And as such, they are not strangers to us. Aging is a natural phenomenon and not something one should be afraid of, or one should just know how to manage it effectively. Because I'm talking about the eye, I want to show you the image of a normal eye. Okay, so this is the retina of a normal patient, a young patient, everywhere is the retina is pink, the can see the optic nerve, round, looking healthy, this is the side view, this is the lens, and this is the optic nerve which serves the eye, and the blood vessel which serve the eye. So as one grows older, the changes that occur in the body also occur in the eye. Our skin becomes lax, our muscles are not as strong as when we're younger, the hair becomes gray, all the changes that happen in the body also happens in the eye. So we'll just take a look at and understand. Okay. So we should also be aware that of the other, either, there's an impaired visual acuity, either the refractive error, or they have glaucoma, that population have some age disease, and as such, people who are elderly, who are at this age group. Hello, can you hear me, please?
It's breaking intermittently, but we can hear you now. Yeah.
All right, now, okay, sorry about that. So I was just saying that the burden of people who have age-related visual changes, for people who are 50 years and above, it's about 82%. So, and that's a large number. And as one grows older, also the numbers increase. And this age group are at particular risk of certain challenges, because they can't see, they may bump into objects, they are at risk of falling, they are at risk of depression because they can't connect with their family, their loved ones, they are socially isolated. And so other things that actually occur as a result of eye visual challenges for whatever reason. Okay. Okay, it's just a slide showing the parts of the eye. All the parts of the eye are affected during aging. Most commonly, we know about cataract. This is the normal lens. Normally, this lens should be clear and crystal clear, like a pane of glass. But as one grows older, just the way your hair grows gray, the lens also grows gray because of the changes that occur, the genetic change that occurs, in the eye. The cornea, the transparent part of the eye also loses its transparency, and because there may be some deposits that may occur, that may deposited in the cornea, also the macula is the part of the eye that serves color vision and central vision, and it's a very sensitive part of the eye. As one goes older, also some changes may also occur on the macula. Okay, the optic nerve is not left out also. Glaucoma also affects the optic nerve. So it cuts across every part organ of the eye. How does that with cataract? Cataract is the most common thing we see in the environment. It's an age-related pacification of the eye. So from 40 years above, one may be at risk of having cataract. The other cause of cataract may be due to trauma, due to drugs, but aging is the commonest cause of cataract in the environment globally, worldwide actually. And also cataract surgery is the number one surgery done globally. It's the one surgery that has the most economic impact and the most performed surgery worldwide. So what happens in cataract? You can see in this picture is opacification of the lens. Here we can see this normal eye here is clear, but this becomes cloudy. So the patient come and say, okay, I'm having cloudy vision, it's not clear. When I look outside, everywhere seems cloudy. That's the first on the common sign we see patients have cataract, you know. And then they may say, oh, they're bumping into people, or they can't see people from afar. People coming from afar, have blood until they come close to them. Those are early signs of cataract. So you can see here, this is a clouded lens. In a normal patient, the ray of light goes, straight on the patient and is focused on the retina here, and the patient has clear vision. But in the cataract patient, as the ray of light comes, it gets the lens and it gets scattered to all the parts of the retina, and that will cause blurring of vision. It gets to a point whereby the patient can no longer see its environment. So at that point, it's quite severe. So we offer surgery for patient have cataract. Once the patient complains that they can't see clearly, surgery is the way to go. If it's a mild cataract, glasses will suffice. Okay. Yes. Age-related macular degeneration. So what happens here? The cells at the macula begin to age. The macular cells are the ones responsible for providing nourishment, providing oxygen supply, they remove debris from the parts of the eye. And as they grow older, the numbers decrease, their function decreases, and the structural integrity is also affected. When this occurs, there's accumulation of, all sorts of deposits at the back of the eye and can give this appearance. So how does this affect the patient? The patient notices, remember I said that the macular cells central vision. So the patient notices a central, blurring. That effect notice that, oh, my central vision is blurred, I can't see clearly. They can see peripheral vision, but that central vision, is affected. And sometimes you have to move the eye to the right to left to be able to appreciate objects in the field of view. It starts gradually, it's painless, but it causes irreversible blindness. Smoking is number one risk factor for AMD, call it AMD. So smokers are at risk, almost 3 times at risk of having AMD compared to non-smokers. Smoking and also family history is also a risk factor, but smoking is a strong indicator, for AMD. Unfortunately, it's irreversible, so we only manage it. So the best prevention is best here. Just try everything you can, to prevent it from occurring. Of course, if in certain condition, when there's wet EMD, we can give intervention, we can give drugs that support the retina. Sometimes we give injection into the eye to help in the eye. Okay, but it's good if prevention is better than cure for almost everything. Okay, glaucoma. Glaucoma is the number one cause of irreversible visual loss. We call it the silent thief of sight because it causes blindness irreversibly. It damages the optic nerve. That optic nerve serves the vision. The optic nerve can be related to the wire supplying a bulb. Okay, if you cut off the wire, the light source is gone. So the optic nerve is the central nerve that supplies the nerve. So the optic nerve the glaucoma actually damages the optic nerve irreversibly. Keyword irreversibly. What are the risk factors? Aging is a risk factor. People that have family history is a risk factor. People who are myopic may also be at risk. Then raise intraocular pressure. When the pressure on the eyes is high, that pressure may actually press on the optic nerve and affect blood flow to the eye. When that occurs, then the blood supply to nerves is affected and leads to neuronal death. Okay, so what happens to the patient that in the early stages, you can see from this picture, is normal, patient is very clearly, everything is good. As it grows, worsens, glaucoma actually, the visual loss starts from the periphery. Periphery means that it affects the surrounding visual field. So if you're looking at someone directly, you notice there's an area around you can see the periphery. So it starts from the periphery and closes in on you. It may not cause any pain, it may not cause any symptoms. So you may not really be aware until it comes to affect your central vision. In this early normal patient, this early glaucoma, we can see that there's blowing around, and then in advanced glaucoma, only the central vision is preserved, the peripheral vision is lost. At this stage, we can see the advanced glaucoma. And the mode of care we have for patients with glaucoma depends on the severity and the age of the patient. If it's early, we can give drugs to help control the pressure. In some cases, we need to actually operate on the patient to try and control the pressure. Okay, so but the main takeaway from glaucoma is that because it doesn't give any symptoms, you have to just examine yourself regularly. Come to the hospital, have an eye check, see the ophthalmologist, you check your pressure, check your optic nerve, and take a picture, do your visual field to, you know, to help detect if you know if there's glaucoma. If the family history is important, you come, have an eye check every year. Family history of glaucoma and any of the parents, mother, father, siblings, you must have, you know, um, a glaucoma check. In Black population, glaucoma, is more severe in Black population. Okay, yes, diabetic retinopathy. So diabetes, because diabetes, the incidence of diabetes is increasing globally, change of lifestyle, diet, lack of exercise, all those things increase the prevalence of diabetes. Uncontrolled diabetes also affects the eye. The way it affects the brain, it affects the kidneys, it also affects the eye. And in severe cases, it causes what we call proliferative diabetic retinopathy. In proliferative diabetic retinopathy, there is abnormal development of blood vessels. You can see the blood vessels here, that develop in the eye. You can see them here. They may cause bleeding in the eye because the vitreous hemorrhage, and also lack of obstructed blood supply to the retina. When this occurs, the area that is supplied by the retina, is damaged. There's cell loss, and if left untreated, it may cause what we call a retinal detachment. That is when your retina is actually detached from the back of the eye. It affects the macula, it can cause edema, that swelling, fluid accumulation at the retina, and all these things affect vision. Diabetes is a systemic disease that needs to be controlled. You must see your GP to control your glycemic control, hypertension. Hello, are we still? Can you hear me, please? Tell me.
Yes, please. We can hear
All
you.
right. Okay. All right.
Thank you. Apologies.
So it can cause visual loss. There can be bleeding in the eye, visual hemorrhage, the retinal detachment, and if the patient don't present on time, there's not much you can do at the end stage disease. So this patient here has visual hemorrhage. You can see the blood vessels here, abnormal blood vessels here in the eye. This can still be salvaged. You can have surgery, you can apply laser treatment, you know, while the patient, most importantly, controls the diabetes. Very, very important. Because if the diabetes is not controlled, no matter how much you don't give to the patient, symptoms persist, like pouring water into a basket. All that, care may not really work. So all patients with diabetes have an eye check, present to the eye doctor, have an eye checks, do a photograph, just make sure you check yourself, please. Very, very important. Okay, it's another phenomenon called PVD. We call this posterior visual detachment. This also occurs among ages. The vitreous start gel in the eye. It liquefies, it loses its consistency and tends to shrink. Okay, and as it does that, it may cause floaters, some opacities in the eye, and patients come and say, "Oh, doctor, I'm seeing something moving in the eye. As my eye is moving, it's moving." These are floaters due to posterior visual detachment. An aging process is innocuous, and with time, the vitreous may detach and come down. However, when the vitreous is detaching, sometimes it may pull on a blood vessel and cause a bleed. Okay, so we need to be aware of that. So if you notice that you're seeing blood vision, you can see it's increasing in severity, your vision is reduced, present to the eye doctor. But if there's no bleeding, if it's just you're seeing that opacity moving, it may be posterior visual detachment. It's quite common in the elderly. So I would present to the retinal doctor or ophthalmologist to have an eye check to dilate your eye, look at your retina, look at the periphery, and make sure that there's no break or that it's just simple PVD. Yes, presbyopia. Presbyopia is very, very common. Um, what happens here? There's a greater decrease in the accommodative power of the eye. What's accommodation? The ability of the eye to focus on the objects. What gives us the ability to focus on the object is the muscles. The muscles and ligaments, and when they contract, they pull the lens closer, adjust the focus of the lens to allow to see close objects. Unfortunately, as one goes older, these muscles also tend to reduce in strength, and also strong as when one is young. The lens itself is not so elastic. So the patient has difficulty, seeing, near objects. they tend to move the objects afar. Okay, I can't see my textbook is blurred, or you see when I read, I have to wait a while before I can refocus, or it's difficult for me to, So all those symptoms are signs of presbyopia. And this, of course, as long from 40 years above, it may present, it may occur. Some people may actually go without, having this phenomenon, but most people at some time, 40, 50, 60, they experience, difficulty reading. So how do we correct them? Give glasses. These glasses help to, yeah, help them to focus, on near objects and, reading. So glasses will help with this. Okay, this occurs among ages, due to deeper deposition around the cornea. Okay, it's a benign condition, age-related, not much one can do, but it's benign. All right, something called dry eye. Dry eyes occurs as one ages. At one ages, there's change in hormonal profile. The lacrimal glands don't produce as much tears as one grows, and then also the lipid production in itself is reduced, maybe altered. So all these things reduce the quality of the tears and the amount of tear production in the eye. Tear is very, very important in lubricating the eye, keeping the eye moist, keeping it smooth, preventing irritation. So when all these things begin to occur, patient begin to complain, oh, I'm itching, I'm tearing a lot, I tend to itch a lot, don't feel comfortable. These are signs of dry eyes. Those that watch TV for a long time, using contact lenses, some medications, or topical medication, all these things may actually cause dry eye. How do you treat? We give supplements, we give artificial tears, tear drops. This will help to relieve the symptoms. You can apply some warm compress on the eye, try and blink regularly, okay, and avoid dry areas. These are how the things we do to mitigate dry eyes. Okay, I just wanted to mention a few red flags to notice. If you notice there's still observation, maybe someone complains that, oh, I can't see solidly, maybe a detachment, maybe due to just hemorrhage, or if there's certain pain in the eye. Okay, pain, the frustration, maybe due to a raise in intraocular pressure, called that acute angle closure. Or if someone has to see sudden drooping of one of the eyelids, due to either a piano palsy or a brain lesion, or if there's flashes and focus in the eye. Okay, those are things that may occur in posterior visual detachment, or retinal detachment. Okay, also above 40, I believe we should have an eye comprehensive eye check every year, once a year. See the eye doctor, see the ophthalmologist. Really, we have risk factors for any of these I mentioned: family history of glaucoma, family history of AMD, family history of glaucoma. Most importantly, have an eye check, annually, yearly. Make the same amount to actually have an eye check. If you're diabetic, you need to see the eye doctor, once a year, or as frequently as recommended, just to have a check. Prevention, better than cure. Smoking is the strongest factor for AMD. Stop smoking. People who are diabetic may also have hypertensive, and that may also be kind of the comorbidities that also worsen eye complaints. So control your blood pressure. If you're on medications, for AMD, take medications. Like I said earlier on, have regular examinations, eye checks, yearly eye checks. Okay, what are the key takeaways we can take from the presentation? So cataract, glaucoma, diabetic retinopathy they are preventable, age-related conditions. If you present on time, they can be corrected. Glaucoma, AMD, they're asymptomatic. Glaucoma is a thief of sight, no complaints until it damages all your peripheral vision, and then you can't see. AMD is also painless, so you need to be sensitive. If you have any eye changes, come to the doctor. Semi control is very, very important, very important. Control diabetes, control hypertension. Okay, and then you should also be aware that other drugs also may give some eye symptoms, like people who are taking drugs for prostatic hypertrophy, people who are taking drugs for glaucoma, or any eye drop also may cause some dry eye symptoms, and sometimes they may be interrelated. Okay, thank you for your attention. We'll take questions and comments. Thank you very much.
Thank you very much, Dr. Jadola. Let's please give him a round of applause. And you can stop sharing your screen now. Thank you so much for that. That was absolutely um, awesome. Thank you. And I'd like to let you know that all our speakers in this series agreed to speak free of charge, just so that they could pass on knowledge that would impact others and help us to age gracefully and to keep us healthy in old age. And we are very grateful to all of you. Thank you so much. Without much ado, I think I will let Dr. Sukomi Anjorin take the announcements right now, and then we'll just hand over to Dr. Shola Fatola. Thank you, Dr. Sukomi.
Right. Thank you so very much, Dr. Ayedu. And thank you very much, my very good brother and friend, Dr. Modupe Jadwala. Thank you for taking us. Yeah, thank you. Same here. All right. How long is the hydration break in World Cup? It's 3 minutes, right? So this is hydration break. Take it as hydration break, okay? So just move your body and all of that. And I just want to do a very brief introduction of this group. This has been a phenomenal journey with aging and elderly and aging. And this is not the only thing we do. The name is the Link family, okay? And it's basically to connect us to resources, to connect us with one another, and to actually make living and life a lot easier for us, because God has not created us to live in isolation. He has created us to need one another. So this is a group that is for all age group of people from ages 16 and above, and is aimed at healing, building healthy and healthier relationships. So we have meetings that sometimes will be bordered on relationships, marriages, parenting, and life generally. And there are people that are part of this group are either single, married, or those who are transitioning between two. And even though there is no particular religion or race or that is preferenced, our guiding principles are as entrenched in God's word. So just for us to know that that's the tenets on which everything we do here is built. And normally we meet on Fridays, and alternately we do meet to greet and meet to pray. And sometimes we do mystery guest, where somebody among us will be put on hot seat, so to speak, and they will ask them questions, and they will share their life experiences and things that they want to share with us. But when we do Friday, when we meet to greet, we sometimes take characters in the Bible and we learn from them. And I can tell you that has been actually very, very insightful for me as a person. I've learned a lot from a lot of people, and you would also do if you avail yourself of that opportunity to join. I don't know if somebody is posting those in the chat room, or yeah. So already we have Stanike posting in the chat room. If you want to be a part of this group, there's a WhatsApp group, and just click on that link, and you'll be admitted into the WhatsApp group, so you can be brought up to speed with what is happening, and you can follow up with the announcements that we may have. And on daily basis, also on the WhatsApp group, we have issues that are discussed, like today being Saturday, if not for this aging group, aging and elderly meeting series that we'll be having. We usually post things about marriage. I'm supposed to be doing that. I do it sometimes.
It's already there. Eh?
I know. Some people help me catch the ball when I drop it. All right. And for all our meetings, like this one, is also being streamed live on YouTube, and you can go to the Temitope Praising Child, and you can, even our past events, you can see them on YouTube. I believe that will be it. At the end of this section, there's going to be question and answer. So please note your questions down and you can ask them when the time comes. And there will be a group photograph where we would ask you to put on your camera so we can take a picture of you. Thank you. And that will be the introduction. I lead back to Temitope Present-Child. Thank you.
Thank you very much, Pastor Sukomi. That was awesome. Without much ado, we'll go to our next speaker, and she's going to be talking to us about lifestyle health and aging. And I will just bring her to our front now and introduce her to us. Okay. Yes, so please smile, Sister Shola. She's my friend, so just allow me. Okay, Dr. Christiana Oluwashola Fatola is a family medicine consultant with a special interest in lifestyle medicine. Throughout her career, she has been passionate about helping individuals and families achieve better health through evidence-based, preventive, and patient-centered care. Today, she'll be sharing practical evidence-based insights on lifestyle health for the aging, highlighting how simple, sustainable lifestyle choices can help people not only live longer, but also live healthier, more active, and more fulfilling lives. She is based in Saudi Arabia and the United Kingdom, happily married with children. She's an amazing friend of mine and a member of the Link family. She was absolutely instrumental in our parenting series, and you should actually go back and watch it. And it's a great pleasure I welcome Dr. Shola Fatola.
Thank you, Temi. Are you okay for me to share now?
Yes, we are.
Thank you. Yeah. Can you see my slide?
Yes, we can see you sharing now. Yes.
Okay. Hi, everyone. Good to be here. And thanks to everyone that has presented. I've been learning a lot, and thanks to a colleague as well. Modupe, thank you so much. You
Hi, Shola.
actually highlighted some of the things I'll be touching today. A few things we'll be doing during this series. There'll be some actions that we'll have to take as individuals, some movements and here and there. All right, so I will just start with definition of lifestyle medicine. Partly Temi has mentioned, but is mostly evidence-based. This is an aspect of medicine.
I think you want to go to the slideshow.
Am I not on the slideshow?
Not yet.
What are you seeing?
You need to click on that icon at the bottom right. That takes us to
the share one, isn't it, on Zoom?
No, you're sharing, but the slideshow for the PowerPoint itself to make it bigger.
Okay, I see what you mean. You know, I've had to borrow this laptop because that one just
yeah.
Okay. How about now?
Yes, that's it. Thank you.
You see, now it's now moving forward and backward. That may be the
we're still on the definition, so you're all right.
Yeah, so I don't know how to move the next one, but yeah, I'll get there. So lifestyle medicine is basically an aspect of medicine and is evidence-based, which means that these behaviors have been tested and have been trusted in order to help us prevent illnesses, treat them, and often reverse chronic conditions like diabetes and hypertension. Lifestyle practices and health habits are the most important determinants of positive health outcome. So it's an habit and it's a behavior and it's a way of life. And that's why we call it lifestyle medicine. So lifestyle medicine actually deals with 6 key pillars. That's what we talk about. 1 is about the diet. 2 is regular physical activity. The 3rd one is restorative sleep, stress management, avoidance of risky substances, and positive social connection. So lifestyle medicine basically talks about this when we are supporting individuals or patients to prevent diseases, to treat diseases, and to reverse chronic conditions. This is the difference between lifestyle medicine and conventional medicine. So conventional medicine is when the doctor says you need to use some tablets or you need surgery. In lifestyle medicine, if you practice the habits and the behaviors, then you are highly likely to reduce your reliance on either option. Secondly is that patients are active recipients, which means patients are actively involved in their own treatment in lifestyle medicine. In the conventional medicine, the doctor will tell you what to do. And again, people do develop most illnesses if they've not followed the habits or behaviors in lifestyle medicine. As we all know, if you do not do any of the 6 pillars of medicine that I just talked about, you are highly likely to move to have conventional treatment, and you're going to pay for it. So interestingly, in the year 2004, there was a geographic explorer and a journalist who was called Daniel Butner. He put together a group of scientists because he's been hearing stories of people saying, oh, in my own area, people live more than 100 years. They were centenarian. And what did Dan do? Dan decided to bring in a group of scientists who went to these areas and went to take data, looked at their date of birth, looked at what was making them what was making them overage in terms of their age and their lifestyle. And they found out that this was common in 5 geographical locations. What Dan and his team found out was that they not only lived longer, they also enjoyed a high quality of life, which is very important. It's not only to live longer, but you want to have a good quality of life. And then they found this in 5 geographical locations, and these are the geographical locations. There was Ikaria in Greece, Sardinia in Italy, Okinawa in Japan, Costa Rica, and USA. So they found that people in this area actually live more than 100 years, and they have common things that they do. And these common things, there are 9 common characteristics. And so they called it the Blue Zone, and it's a project, and they described it as the power of 9, which we're going to talk about. Now, coincidentally, the 6 pillars of medicine and the power of 9 are linked together. It's like we are saying in modern terms, this is lifestyle medicine, but actually, even this years and years ago, this is still the same thing, the same practices, the same habits, the same lifestyle, the same behaviors that have been adopted. And a fact was established that only 20% of how long the average person lives is dictated by the gene. 80% is by the lifestyle. So you change your lifestyle, you change your health. Now, I will just paraphrase all these rule of 9. The first one is move naturally, understanding purpose, downshift, which is how to distress, rule of 80, diets, and I'm going to talk about them one after the other, link them to modern medicine, and we're going to do some activities that relate as well. So this is me putting them side by side, and we are still on one truth. 6 pillars, power of 9, one truth, lifestyle medicine. So the first one is move naturally. What does it mean to move naturally? This is not exercise, because I remember the orthopedic consultant who came in and was telling you that exercise is quite different from, and it was actually right. So, and everybody that has come to speak has either mentioned the chronic condition, diabetes, hypertension, or mentioned that lifestyle medicine is very important. What does it show you? That even though we've had, I think this is week, what are we now? Week
10.
Week 10. So we've talked about 10 different specialties, 10 different areas of the body, and we are still talking about lifestyle. We are still talking about improving your lifestyle. So physical movement, it just means that what they found out was that these centenarians were actually moving effortlessly. They stand up to turn on the lights, they stand up to do our chores, they stand up to do basically everything. So in modern day life, we can also form the same habits. Sometimes I put my pen downstairs and I know I'm going upstairs, but I know that when I'm tired and I need something, I'll go and pick the pen. Those are just the easy movements. It doesn't have to be long 2 hours, because at the end of the day, all these things, they compound, okay? So again, modern guidance, any movement helps. 30 minutes, 30 seconds. The goal isn't intense workouts, frequent, low intensity movement. And sometimes don't beat yourself up and saying, okay, I'm supposed to do 2 hours and I can't do 2 hours and I'm tired. Even if it is 2 minutes that you can do, go ahead and do it. That's what habits are made up of, the little things you do. And so this is our physical activity. I want every one of us, I think we're 38. So if we can, I can't see everybody. I would have brought my D4 camera. So let's all stand up. This is our own little activity for today. Let's all stand up wherever you are. Stand up. It's just for a few minutes. Stand up. So if you can take a step forward, take a step forward. If you can take a step sideways, I can take a step sideways, but not forward. Take a step sideways. Yeah, a bit of stretches. And then you can have a seat. Thank you, Brother Sukwami. You are even putting some jogs. So have a seat. Yeah. So that's just what physical activity means. Yeah. So on to the next one. Diet. Diet is another very important thing that they found out. They found out that these centenarians, 90 to 100% of their diets are plant-based. The leafy grains, the whole grains, the different kinds of nuts. They also found out that it was common to them that they only eat meat rarely. When there's a celebration, that's only when they eat meat, which means make sure that if you want to be 100, and it's not about the age, want to be a centenarian, good at your old age and enjoying a high quality of life. These are proven records. And they found out that they drank red wine, but only 1 to 2 glasses, and they only have it when they have friends around or with food, not loosely. Now, how do we bring this into modern guidance? The most important thing is a colorful meal. And when I say a colorful meal, we call it a rainbow diet. Rainbow diet, when you have a plate of rice and stew, those are 2 colors, white and orange. And then you have your protein, it may be egg, so just make it a rainbow diet. That's very important. Avoid processed food. And the way I explain it to people is when you want to eat, let's say you want to eat chips and you want to eat potato. Now, if you boil potato, you're actually just eating one, it's not even processed, it's, let me say, partly processed. But if you fry it in oil, you are eating the potato and you are eating oil. So that means it's processed. So if you can, think about it. Apple, if I want to eat an apple or I want to put it in a blender, that's just one process. But before it will become apple juice and stored, it goes through about 2 or 3 processes. So the lesser the processed food you have, the better it is. Think of ham. At the end of the day, ham is made from pork. But does it look like the pork you're getting from the butcher? No, it has been processed. So sometimes if you want to caution yourself to eat healthy, think about it. How many processes has this food gone through before I eat it? If it's too much, then it's unlikely to be healthy, and that's pizza, So avoid processed food, eat in proportion, and we always advise plates. Okay, so the sides and the plate, they have a connection, and your brain. So if you have a big plate and then you put just 1 handful of rice in that plate, your brain will instantly tell you that, Ole Yomi, I can't be full. This is not going to work. And then you have another portion and another portion and another portion. But if you take a small plate and put a hand cup of rice in that small plate, there's a connection between your mental health and what you're seeing. And then you know that sometimes, most times, you will know that, okay, I think this will do. And you can be able to caution yourself. So that's what, if you know you want to be eating in proportion, which we all advise, please make sure you're eating with small plates. Stop eating when you're 80% full. This was very interesting to me. And by the way, I think I have a right to speak on this topic because my grandmom died at age 104. She lived with us for 10 years, and I could relate with most of the things in here. So when you're 80% full, it is okay. That 20% that you don't want to leave, accumulation of that 20% is what may lead to diabetes, what may lead to high blood pressure, high cholesterol. So let's normalize, when I'm full, I'm full. It doesn't have to finish. It will waste. You know, let's normalize 80% full and that's it. Avoid added sugars. Now, added sugars come into different products, different ways. I've put honey there, but I know they are natural honey. So if you want to use honey, make sure it's natural. But these are list of added sugars. If you're not sure, you want to buy an item, look at the back, look at the preservative. You see things like fructose, you see things like dextrose. If possible, avoid it. Now, these are underrated food nutrients. You want calcium, green leaf vegetables, magnesium. These are the things you can eat: nuts, beans, avocado, potato. Fiber, you eat exclusively plant-based diets. Potassium, think about spinach, banana. Vitamin C and vitamin D, red pepper, raw carrots. All these things are contained in vitamins. And we also say you only need multivitamins if you're not having enough vitamins from your food. If you're having normal, regular food and you can eat all these foods that we've talked about, you're unlikely to need multivitamins. And it's very important, if you think you're lacking the vitamins, please go get tested before you have extra vitamins so that you won't be overdosed. So now this is another activity. Before this meeting, picture your last meal. Mentally divide your plates. How much was your processed food? Your vegetables, your carbohydrates. How much fruit have you taken today? And the self-awareness of this will help you. On to the next one. So they noticed that these centenarians as well, one thing they practiced very well was restorative sleep. They had a way to shed their stress off. Now, what do we mean in modern terms about good sleep? 7 to 9 hours nightly is linked to optimal health. A lot of us, if we don't have good sleep at night, we wake up with foggy head, headache, we become cranky, irritable, and these are actually avoidable. What ways can we can we adopt good sleep? 1, have a sleep alarm, regular wake-up time and sleep time. I have had to do it this year. 9:41, my alarm goes off. I have to leave everything I'm doing because at the end of the day, half of the next day becomes pretty useless if you don't have a good sleep. So if it's avoidable, if it's avoidable, then it's advisable that you have a regular and consistent sleep and wake up time. No screen before bedtime. Avoid large meals late at night. So these are the ways that we can improve our sleep. And when you're sleeping, if you know that some people, what usually wakes them up is their to-do list for the next day. Have your to-do list, write it down the night before, prepare the night before so that you can have a good sleep. Now, this is very important and it applies to almost everybody. Stress management. The people of the blue zone, they have a daily stress relief ritual, different stress relief ritual. Some of them, like the Adventists, it was prayer. Some of them, like the Okinawans, was remembering their ancestors. And we found out, medicine has proven that when there is stress, there's inflammation, it depletes the immune system, it makes diseases come in. And it also makes it, difficult to treat chronic diseases. So what are the ways in which we can help with our stress level? Breathing exercises, travel, take time off. Like I tell people, oh, there's nobody to do it. There's nobody. If anything happens, people will do it and the work will not suffer and nothing will happen. So look after yourself. Have your me time. Even if it's 30 minutes in a week. I'm not even saying in a day. Start with a week first. 30 minutes a week. Have your me time. For those of us that have children, I know that a lot of us, and I've shared it, the children will be fine. They will always be fine. Have your me time. Take some time off. Have spa sessions, cinemas. Yeah, you work very hard. Enjoy your money. Enjoy your life. It's only one life. And so I want to teach us this breathing exercise, which is box breathing. Now, for everybody, we are going to try this. We're going to repeat it 2 times, not 3 times, because I'm not sure what the time is saying now. So we inhale. So breathe in, and then I'll count 4. Breathe in. 1, 2, 3, 4. breathe out. 1, 2, 3, 4. So we are think about a square. So we are going again. So you know how to breathe in and breathe out. So again, breathe in. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. And hold it. 1, 2, 3, 4. Let's go again. Breathe in. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. And hold it. 1, 2, 3, 4. So that's box breathing. And it's usually very important and it's very effective, especially when you're stressed. It helps to calm the mind as well. So they also found out, very interestingly, that one thing that the centenarians practiced was their loved ones. They made sure that that was an important, sorry, I think that's where, just give me a minute, please. Sorry, I'll have to go back to the slide I was, okay. Can you still see my slide?
Yes.
Okay, so I just need to maximize it. Am I right?
Yes,
Okay.
please.
They found out that social connection was very important to them. Yeah, social connection, very important. They all belonged to a tribe. They all prioritized their loved ones. In these 5 regions, they found out that all of them belong to a faith, okay? And then they attend a faith-based service. Knowing further, the Christians go to church at least once a week. Those that that are in other religions actually practice at least once a week. So if you've been doing that, you're doing the right thing. Yeah. They also found that, which is very important, is that families and elders are integrated into daily life. So everybody stayed in the compound. The first generation, the second generation, the third generation, the fourth generation, everybody lived close to each other. So this is very important. If we have if we have our family, our loved ones, please let's try as much as possible to connect with them. Yeah. So these are the things that made these people live 100 years and above, and not only live that life, but enjoy the high quality of life. Health behaviors and contagious. That was what the Framingham Heart Study showed, that happiness, if it's spread from one family to the other, is usually contagious. Social network is contagious. Smoking is contagious. Now, modern activity or modern guidance, what do we do? So the activity for now is think. I'm just going to pause again for a few seconds. Within yourself, name 2 persons or groups that support your healthy lifestyle. Who are those people that you know that when you go out with them or when you are with them, you do things that are productive? Find the league for me is one. So this is very important. And those are the places, those are the people, those are the groups you want to continue to interact with. So another activity for us today is reconnect with family or friend and stay connected. After this session, think about a friend that you know has been very productive, or a conversation that you know has been very productive. Pick your phone up. Somebody you've not contacted for a while, speak with them. That also helps. Next is avoiding harmful substances. We all know, even the people that make the cigars, always write it on it. Smokers are liable to die young. We don't need to be told. Anyway, so if you smoke, if you vape, then that's not very good, because they found out that these people avoid smoking almost entirely, and we talked about them drinking alcohol very moderately, only during important occasions. So avoid taking harmful substances and taking drugs. All this leads to longevity. So purpose. One thing that was important as well that was discovered with people who lived in the blue zone areas was that they had a clear sense of purpose or direction. So they wake up because of a reason. They wake up to do something. They wake up because they understand their why. And this is what is known in modern terms as ikigai. You have a clear direction of waking up. Why am I doing this? And they found out that our purposes are always linked to our daily activity and linked to other pillars of lifestyle medicine. Now, what I will advise is have a purpose statement. What are your values? What are your skills? Who are you using it for? Who do you want to help? Who are you volunteering? And when people ask me, what do I understand? I mean, what do I mean by purpose? I just say something that you do effortlessly and you're productive with. Something that you know that if I do it, some people just go on the piano, they play it very effortlessly, but it blesses people. And that's why you see people on the streets in the UK, and people give them money for it. Some of them is not the money they need. They just enjoy doing it. So that's your purpose. And the more you understand your purpose in life, the better it is, you'll be more fulfilled. And for every task and every action you take towards your purpose, you will be happy. There's a feeling of fulfillment that comes with fulfilling purpose. Another important thing about purpose is you can micro volunteer an hour a week aiding a local cause. It could be a charity you belong to. It could be just helping your neighbor. I remember I used to have an elderly lady who was my neighbor, 85 years old. Every day I go there, all I just do is wash her plates. And it's just only one plate in the sink. But it just gave me that fulfillment that I was doing something very productive. And then after that, we have a tea and then we just smile and laugh. But after living there at that place, I know that I have done something. Again, it's not only good for her, it's good for me as well. So very important to understand our purpose. And very importantly, I think this applies to all of us, that we should drop habits that drain our energy and redirect those hours towards a creative project or learning goal. A lot of things drain our energy nowadays. There are a lot of distractors, Instagram, TikTok, Facebook. Oh, let me just go there for 5 minutes or my 5 minutes break. And then 5 minutes turn to 2 hours. And then 2 hours turn to 3 hours. Yeah. And these are the things. Some people, it's just the environment, very toxic environment. They just drain our energy. So let's try. These are the ways that we can manage our stress, fulfill our purpose, and become better and age gracefully. So, action plan. We've talked about a few things today. Physical activity. Remember, it's not exercise. Try to walk, even if it's one small step, from one room to another. Stretch your legs. Nutrition. Add one more plant-based meal. What's that food that you're thinking, oh, I don't think I like it, but you've not even tried it and you know it's healthy. So it may be a good time to do that. Movement, take a 10-minute walk daily as you can. Sleep, set a consistent bedtime. It could be the alarm. It could be, it could be, you could have an accountability body to tell you, oh, it's sleep time. Yeah, stress. We've talked about the box breathing exercises and how to discuss about a few things on how to manage stress. We've talked about tracking alcohol intake very minimally or not at all, if possible, and connection, which is very important. So today, try to call or visit one person you care about. We've talked about that. Again, remember what I said, your genes are your destiny. So your gene is only 20%. Your lifestyle is your destiny. Your genes are not your destiny. I'm sorry. Your lifestyle is your destiny. The changes you make today will change your lifestyle and ultimately change your future. Thank you.
Thank you so much, Dr. Shola Fatola. You can stop sharing. Thank you.
You're welcome. Just let me stop sharing. Yeah.
Awesome. So, going to add the speakers for today. Please help me give Dr. Shola Fatola a round of applause. I'm sure we've all learned amazing from her session. It's been great.
Thank
And we
you.
all know where the shoe is pinching us. And I hope we have our questions ready.
Tọ́lá mo
Dr.
wà bí mò ń
Modupe
pàtẹ́wọ́ o.
Ijanola.
Mò ń pàtẹ́wọ́ o.
Okay, sir. Thank you. Dr. Ijanola, let's have your camera now. We're about to start taking questions. Thank you. Okay, that's been amazing. So who wants to go first? Okay, so I have a question first. My first question is for Dr. Ijanola. So do you mind just going over, you don't have to show us the slide again, but just tell us about how often we need to check our eyes from the age of 40, because some people are just not bothered at that age. In fact, there's some people I've sent this series to and they believe I'm sending it to them. Why don't I send it to their mothers and grandmothers instead? They don't know we are all getting there, so we should just get set. But how often should like a 40-year-old or someone in that age bracket start checking their eyes? And if a 40-year-old has a father with glaucoma, how often should they check their eyes? That's
All
your
right. So once you're 40, I recommend yearly. Once you're 40, yearly, even general checkup yearly is advisable to yearly. If you have a positive family of glaucoma, especially, you mustn't miss it because glaucoma it's hereditary and it's more aggressive if your parents have a positive family history. So if you go and meet a ophthalmologist and just tell them you have a family history of glaucoma, they will tend to treat you more. I mean, they treat you more. They pay more attention to you because
urgently.
they know urgently. They know that you know, your pressure can go up. You know, you may have. They want you to go blind. You know, especially if you're blindness in the family. When you have
Yeah.
blindness, okay, come on time, give early appointment. Let's run the test. Make sure you're okay. And prevention is better. You know, if you catch it early, you can maintain that vision throughout your life. But once it's late, it's difficult to treat.
Okay. Thank you. Last thing, I want you to go over those red flags for the eyes, because I know a lot of people might just not take it. They might take it with levity, but the eyes are so important. Once it's gone, it might be gone completely. So please just go over those red flags when it is you must see an ophthalmologist as a matter of emergency. I want you to go over that. But I'll come back to you. My next question is for Dr. Shola Fatola. So,
So generally, I would say that
okay,
if you
go
have
on.
an eye complaint, I recommend you try and see an eye practitioner, generally speaking, because there may be something more sinister happening behind. You know, but if you see things like still loss of vision, vision suddenly drops, or have what we call differential field loss, you can't see one area of your field of view. Maybe you can't see your nasal side, the temporal side. You know, you can see an ophthalmologist. If you have pain in the eye, sudden severe pain, you know, or you know, there's sudden drooping. One of your upper lids just, you know, gets drooped. You know, there's ptosis here from all this. You know, these are some common things you should bear in mind. But generally speaking, have a complaint, use an eye drop first, second day, you're not getting better. Just go and see the ophthalmologist, please. It's safer than it.
Thank you very much. I know even with paracetamol, they will say if your symptoms don't resolve within 48 hours, see your doctor. I must mention at this time that because doctors are scarce, we also expect everybody to do a little bit of, let me not say anything
Before
do,
presenting.
do some groundwork before they approach their doctors sometimes. So some people have headaches that are associated with some change in their vision. They already know it's due to their headaches. If it changes in some way, please speak to your doctor. Some people know that when they are in hay fever season, they have some issues with their eyes. It's itchy, it's red. You already know you might need antihistamines. Speak to your doctor to get some, or if you can get some off the counter, get it. So I'm trying to say, please contact your doctor if you think that this is something out of the ordinary, but don't overburden us. Thank you. Yes, Dr. Shola Fatola, now I have an easy question for you and I have a hard question for you.
Yes,
The
ma'am.
hard one, I will allow you to breathe on it, and that is, if your toxic environment is your spouse, what do you do? I'll let you brood on that one. The easy one is Now, you said that health habits are contagious. So, for somebody that is obese, what are your thoughts about Mounjaro injections? Very active weight loss. What are your thoughts about that? Of course, some of us already know that our habits are spreading happiness. We are happy people will make you happy. But some of us are also dealing with the other one of God, I beg go. We don't want to pass obesity to our children. All right, so that's your easy question. So let's hear you.
So which one am I answering first? The
The
hard
easy
one
one
or the
now.
easy one?
The
Okay.
easy one.
Yeah. So there is no chronic illness or disease, including obesity, that still do not require lifestyle practices. Even if you use Mounjaro, you don't change your diets, you don't change your physical activity, you will still be obese. So I usually tell my patients, go and try physical activity. Go and try healthy lifestyle first. And this is about a half an hour appointment, because one thing about lifestyle medicine is that you don't put pressure. The patient is the most important person. So if somebody tells me, I want to cut down on carbohydrate, we start from how many slices of bread do you take? If you tell me 4, let's remove 1. I won't say stop bread, because it's not easy to stop bread. Somebody's smoking. You can't say just stop smoking and they will stop smoking. If you're smoking 20, taking 1 out is a step ahead, is a way to go. So with Mounjaro, if you cannot be disciplined with lifestyle practices, don't bother. Because at the end of the day, it's just going to be a useless venture or a useless treatment. So you still need that lifestyle activity to reduce obesity or any chronic illness. And that's why chronic illnesses are reversible if you do the right thing. Hypertension is reversible, diabetes is reversible only if you do the right thing. And there are facts and there are researches that have proven this. Even in 5 years' time, those who had their diabetes reversed, 5 years later, they still checked them and the diabetes didn't come back. They must have done something different. Yeah.
Amazing. I still remember I was talking to a patient of mine recently and letting the person know that weight loss of 10 kilograms would drop blood pressure by 10 points. And that technically people can go off medication if their blood pressure goes down. And I also want to add to your point about the weight loss. Some people might not know that Mounjaro is weight loss injections, and there are quite a number of them on the market now. And some people are just going for them. But just like gastric bypass surgery for weight loss, there's a lot of counseling and psychological therapy and nutritionist therapy that goes into it, because some people are known to even have weight loss surgery, which is actually removing part of their stomach, and they gain the weight back after the weight loss surgery. So I completely agree with you about maintaining healthy lifestyles that are sustainable. Before we come back to you, Dr. Fasola, I think there's a question for Dr. Jadola in the chat. And it says, generally speaking, are there particular diets we need to watch out for regarding our vision, those that might present a danger to our sight, and those that may help improve our sight? And then he says, I remember growing up, we often associated bad sight with drinking Gary. It's called cassava flakes for those that might not be familiar with it. Go on, Dr. Jadola. That's your question.
So generally we'll say that leafy greens are good. But anything green is good. Vegetable green, lent green is very good. Green for the eye. I think as per Gary, I know the cyanide content, for the Gary taking at time, unprocessed Gary, that's why we said, oh, don't take Gary, affects your, your vision, not good for the eye, because the cyanide that's, in the Gary. But green generally, whatever I eat, try and put greens, I agree with that, Shola, with all things you said. Greens, greens are good. Greens are good. You can't go wrong with greens, greens. So that's it. That's
Good.
yes, greens.
Thank you. Dr. Shola, back to your question.
So the question is, what if the spouse is the
toxic environment?
Don't let's use only husband. Let's put spouse, because they
yes, spouse. Yes, that's what I meant.
Yeah. Okay. So it's very important. One key element that we all miss out in relationship is communication. So again, when you say somebody is toxic, one thing I found out is that some people do things and they don't know they're doing it. And recently I registered my teenager to a boys club, and they were talking about a boy said that, oh, my dad doesn't show affection. When I tell him I love him, he doesn't reply back. And you know what the teacher said? What if that is how he was raised? And that could be completely true, because they don't know. So when you say toxic environment, has there been something that's been happening before and stopped happening? Because before you say somebody, you're married to somebody who is toxic, there may have been signs. But okay, now the marriage has happened. One, communication. Get to talk to the person, except of course the person doesn't want to listen. And that's why we say never get married to somebody who does not have someone they listen to. That's very important. So if you're communicating this toxicity, that the spouse is toxic, you're trying to talk to your spouse about being toxic and they seem not to understand, or they just don't want to listen, then it should be the next person that they listen to. However, my own rule in life, me first, let every other person be at my back. So again, this is stress. How do we manage it? If it means this is not a ground for divorce, definitely. So speak with the person, communicate. If the person is not listening or does not understand, get somebody that speaks with them. If they don't know what they are doing or they don't understand, get a marriage counselor. So that is what I will advise. Again, except of course, the atmosphere is so toxic that there's physical abuse, then you should know what to do. So yeah, but but that's yeah.
Sister Shola does not want to use all her mouth to stop.
No, but at the end of the day, because at the end of the day, wherever you find yourself or whatever you are doing, always realize that your life is very important. If you want to live long and live healthy, there are things you need to do. So it's about prioritizing yourself at the end of the day. And if you communicate this to people around you, and that's why we say the Famian study shows that these things are infectious, because if you don't eat a particular food in your house and you go out and hear that this food is healthy, for the first 1 month or 2 months, they won't even answer you. They'll be like, what are you talking? You're the only one. After a while, depending on how you're bringing out the food or you're cooking the food, they will just say, let's taste. From let's taste, everybody starts eating. So that's what we mean by healthy lifestyle. There's something about healthy lifestyle that is really, you can rub it on people, family, friends, and all of that. Yeah, so that's the way I will approach this toxicity situation.
Thank you very much. And of course, some people, it's not just their spouse that is toxic. It could even be their children, unfortunately. And I must say that if you are in a persistently toxic environment, it would increase your cortisol levels, which is the stress hormone. You would age faster and you probably die younger. But it's always good to know that as an adult, you have choices, and it's up to you to make choices that are good for you in the long run and are healthy for your mental and physical well-being. That's very important. Before we go, I wanted to share something. Me too, I wanted to share something. And I want Dr. Fatola to tell us about which one she considers the healthiest. This is number 1. Can you see?
Okay.
Yes, yes, yes. So we have grapes. That is what's it called again? Beetroot, blueberries, strawberries. There are olives. There are olives there. Please mute the person talking. There's kiwi. There's pawpaw. Okay, let me stop sharing. How will I know what is inside there? Because yours truly. But anyway, let me go to the next one. I don't know how many colors are in this one, but Dr. Fatola might beg to differ.
Hmm.
1, 2, 3, 4. Abby, do the 2 greens count as 1, or this not healthy enough?
No, for the other green, is there something in the other green? One appears whiter.
The one with egusi now.
Okay, so they are different then.
Okay, okay,
Yeah.
thank you. Okay. Let me find another one. I don't. Okay, you've not seen this
You're
one.
making us salivating because this.
You can tell me.
It's okay. We are talking lifestyle hits. Allow
Yeah.
me. Allow me.
Yeah. So this is a
Okay.
good plate.
It's a good plate.
This is an excellent plate. Yeah.
Thank you. Thank you. I
Yeah.
thought so too. I thought so. The people eating it will live longer. I think so too. Let me look for the next one. Okay. Some people may beg to differ on this one, but here we go. Here we go. That is Turkish cuisine, but do you think?
So you have lamb chops. Lamb chops is still okay.
From that distance, you recognize lamb chops.
One of my favorites. So
okay.
it's not processed. You can make it yourself as well. So that lamb, let me see. What's in that lamb? Let me see. Yeah.
There's lamb, there's aubergine, there's tomatoes, there's couscous, there's white rice, there's chicken.
Yes, again, this is good, but can only one person sit down and finish this portion?
No, it was for 6, so don't fear.
That's right. Yeah, so because we talked about portion control as well. So,
yes. Yeah. And then lastly, there's this one. It's quite colorful actually, but I don't know about. I think it's somewhat healthy, but some might beg to differ.
Kimchi.
There's wasabi. There's kuli. I think kuli should be healthy.
What's kuli? Kuli.
Yes, it's made from granules now. Is that not nuts? It counts as nuts, Abby.
Yeah, and it's not processed. It's not processed.
Okay.
So what else?
I think this is about it. This is about it.
So the only item healthy in that one is the kuli. Every other thing is the biscuits. Are they not biscuits and chin-chin?
Yes, and the wasabi. Isn't the wasabi?
Okay. Somebody is saying, show me amala. And like I said, please, it doesn't mean you can't give yourself a treat. It just means that it's once in a while. They shouldn't contain the major part of your food. If you go to birthday parties, you don't go to birthday parties every day. So by all means, treat yourself, but just make sure that you're doing lots of portion control. And the first thing you notice is if you've been taking 2 cubes of sugar, those are the practical things. If you use 2 cubes of sugar for for tea, just reduce it to 1. Start from there. It's not, as they've said it now, I must take 2 hours walk tomorrow. What happens if you can't take 2 hours walk? Take 2 minutes walk. What happens if you can't take 2 minutes walk? Take 2 steps in your bedroom. That's healthy lifestyle. That's where it starts. Just 1 step at a time, 1 activity, 1 action at a time, and then it gets better. And it's very important. Another thing that I found out is that if you rush into it, you rush out. So a lot of people want to do weight loss. My New Year resolution is to lose 4 kg. Because at the end of the day, and it's also important that get an accountability body. Healthy lifestyle is when you know that I'm going out with my friends today and we're only going to eat healthy meal and we still have fun. So it doesn't have to be, just get an accountability body, or you yourself, make yourself accountable. If it's there are a lot of apps you can download and say, okay, what am I eating? What am I doing? Am I moving towards my goal? It's not only food though. Am I moving towards my goal? That place I said, I'm not going again because they belittled me, or they made me feel worse than myself, or they bullied me. Don't go there again. Even if your mind wants to tell you to go there, tell somebody that will tell you that place is not for you. So like we've talked about, toxic environment, toxic people, anything that is not going to make you live long, please just avoid it. Thank you.
Absolutely. Thank you so much for that. You guys have been awesome. You doctors, distinguished doctors. They are both my classmates. Hey, see me farming. Dr. Anjorin, let's hear
there's another question in the chat room. If you maybe you can read that, but I have 2 questions.
Dr.
Sorry. And I know there may be other people who have questions here, but I'm asking one of the questions for a friend.
Please, if you have questions, raise your hand. before time goes. So someone's question, sorry, I'll take this question first. When I move my eyes sideways, I see strands move within my eyes. Is this normal? If not, what do I do?
Okay, so seeing strands in your eye most likely due to posterior bridge detachment. That's when the gel of the eye, it liquefies. It's not as let's say stronger adherent to the eye. Okay, and the picture I showed earlier on. So when it's shrinking, you see the floaters going here, street line moving here and there. After a while it should subside. But pay attention if you notice any sudden drop in vision, or you're seeing like the floaters increases, then please go and see a doctor right away. But generally speaking, due to posterior vitreous detachment.
Thank you very much. And Dr. Tolu, I can see Abula and Amala. Yeah, those ones are different colors. And I believe Dr. Fatola might be able to confirm whether they are healthy or not.
When you are showing us things that will not fool Bele, you see now, somebody had to. Anyway, my first question actually is about also for Dr. Ijadola, and for children generally, when they had to use corrective lenses or glasses, is it something that with time would expect improvement, or is that something that has to be done and that they would get off it with time? That's my first question. Just generally, is children having to use corrective glasses. What's your take on it, and what is the expectation for whether it's going to be for a long, depending on what is being treated? And the second question is for Dr. Shola. Maybe you should take that first, or I should.
I think you should take the question for Dr. Shola first. Dr. Anjorin.
I should ask that one. Okay.
Don't let me start. It's aging and elderly series we are doing that. You have got children into the matter.
Because I asked it, and I said it's because somebody is worried about their kids having, prescribed that, and they are wondering if it's going to. Anyway, so for you, so
want the children to also live long.
Yes, and you have to start from there, if we are going to. But my question for you, when you were talking about, they go for vacation, spa, and all of that, and I was just thinking, some people might be wondering, and then some of the things we talked about, healthy diet and all of that. How would you speak to somebody who is thinking about, I don't have the money, I can't afford what you are saying? You're talking about being in a toxic environment. That is the environment I am. I can't afford Island. I'm just saying, I'm in the mail. So what are you going to say to people who are looking at it from the angle of, I can't afford what you're saying?
Okay. Do you want me to answer? I thought
yes,
Dr. Jadola was answering first.
Okay, Dr. Jadola, please answer 1 minute. And then Dr. Fatola will take that question. Thank you.
All right, so depending on the age of the child and the type of error the child has, so the child will actually be short-sighted, called myopia, or long-sighted, called hypermetropia, or astigmatism, So depending on age, the eye changes. I mean, the refractive status of the eye changes as the child grows older, until about 8 to 10 thereabout, when it's it's a bit stable. So if I give a child glasses maybe at 2 years, by 3 years I expect it to have changed, because the eye still the refractive status is changing. However, that being said, if a child needs glasses, you've done the test, there's an error there, it's recommended you give the glasses for the time being. As they grow older, they may not need it. As the eye changes by itself, you may not need the glasses eventually. Okay, and for some children, it's only when they are doing near work, when they are reading, or when they are, watching TV, anything that requires, accommodation, and when they have, complaints, my eyes are aching, but when they're not doing that, they're fine. They're fine because, near work, I said near work requires more muscle power, more, focusing. So when they do that, if they need help with glasses, if they have an error, that's the summary.
Thank you very much. Dr. Fatola, you can take a question now.
Okay, thank you. So I've realized that a lot of organizations, church, mosque, friendship groups do organize or have dates. Let me call it dates. Because in church, there will always be, we all have that small clique of friends. So even if you cannot afford to go out or to go to all these places, how about your quality friends? It could just be in somebody's house that people organize these things. It could just be three friends, they come together in their house. One person, it's even so rampant now on social media. One person will bring popcorn, one person will bring banana, one person. So it just shows that it's not how much. It doesn't have to be luxury. It just have to be that connection. It just have to be the right people. So that's what I will advise. Again, a lot of these people who feel they don't have anywhere to go is because most of the time they want to feel isolated. Look at when we started Find the Link. During the pandemic, it was everybody always looked forward to coming there because that was what was available at that time. But some people will still not want to come, i.e. personality. So if you're in trouble, most isolated people, when they're in trouble, then it's very difficult to know. But if you are valuable, or if you're adding value, or if you're a part of a system that works, and when I mean system, it could even be friendship system. When something is wrong, even if you don't open your mouth, they will know. So I encourage people as well. This is one of the things that we saw that has been proven, even with this centenarian, they had a connection, a social connection. It could be loved ones, it could be family, it could be friends, it could be, we've all made relationships with people that are actually outside of our family, and they are more like family to us. So at the end of the day, I would say stick with your environment, but with toxic environment, you will need to learn how to manage your own stress level. And that's why, for example, people will say, I'm not forgiving because I want to forgive them. I'm forgiving because it's of me. So manage your stress level. There are some things that you can't change. If you don't have money to go to another house and that house is too hot, you'll have to manage it. If they say, good morning, good afternoon, good evening, because you know that it's any time that you talk that the environment becomes very toxic. It's what you say they're going to hold against you. Then keep quiet. So that's part of management. And you see that by the time you start doing those things that will help you, the environment will be calmer for you. So even if they're coming for, if they're bringing trouble, they don't have any evidence. With the trouble, you're even keeping quiet. So they don't have any evidence. That's the way, if you feel that there's a particular environment that is not, it's just like going to work. The environment may be toxic, but you need the money because you have a goal to meet. You have house rents to pay. At that time, unfortunately, you just have to manage the situation until you are able to get something better, or until you're able to leave that environment. So that's what I mean by managing. And for the environment, if you cannot afford something luxurious, do, and even with little things, part of it, part of what I tell, especially my parents, celebrate, I mean, my patients, celebrate your little win. If you lose 0.2 kg, I will make sure that you buy yourself a present. It's part of it. Celebrate yourself, love yourself enough, show up for yourself. So at the end of the day, you are doing things for yourself. And it's what you do for yourself that will transmit to other people around you, your family, your friends, your colleague, whoever is around you. And that's the way it works. Thank you.
Thank you very much for sharing that. I remember telling somebody recently that she needed to start with loving herself. And there was the mention of even her parents told her she was a mistake. But this person I'm talking about is already a grandmother. But you can imagine somebody carrying that much trauma. And I had to say, they have come, they have gone. You are here now. You need to start loving yourself. You deserve a space in the world. So you need to love yourself and be happy. Being happy is a choice. And when you decide to be happy, you spread the happiness because that has now become who you are. And about the weight loss, I remember telling people about the fact that the fast food industry work with colors and all of that. The colors orange, red, they're very attractive, which is why you might know some companies that use that. Same thing with plate sizes. The color of your plates matter. The size of your plate matters. Taking water before a meal, chewing your food, which our parents taught us to do. All of these little things add up. Even deep breathing. If you're in a choir and you breathe deeply, if you swim and you breathe deeply, you're going to lose about 1 kilogram a year without even doing anything extra. If you stop eating after a particular time in the evening, you're going to lose belly fat without doing anything extra. And it's so amazing that by the time you tell people about this, they just become motivated. They just begin to think, oh my God, I can do this. And that is what lifestyle medicine is about. And I thank you both for coming on this forum to talk to us about these issues regarding the eyes, regarding lifestyle, regarding how we can change and help each other. And it's been a great pleasure having you. Thank you so much, Dr. Ijadola and Dr. Fatola.
Thank you for having us.
Thank you for
Big round of
inviting me.
applause. You're welcome. Big round of applause for our speakers today. We have another episode next week. Please join us. It's our episode 11, and we are looking forward to it. Dr. Sukomi, what is episode 11? I'm looking for your trouble now.
You just like to blast me. Quickly check it. I don't know.
Yes,
I know it's
I'm looking for it too. I'll find it.
you said I know you've sent it to me, but
I've sent it to different people. Yes, in fact. Okay, yes. So episode 11 is future planning for the aging. And we have 2 lawyers who will be speaking to us. One is from the UK and one is from Nigeria. It's going to be an exciting time, a very interesting time. So please join us, invite others. It's going to be great. If you don't mind kindly putting on your cameras so that we can see your beautiful faces, take the group photo now, and then we'll say our motto and say our goodbyes. Thank you very much for staying with us till this time, and apologies for running a little late. Dr. Sukomi, are you able to take the photo today? I can't find Dr. Ijoma.
okay, let me see.
Able? Let's see your face.
Okay. Let's keep having our cameras on.
Yes, cameras on. Smile. You're beautiful. Smile, smile. Yay, yoo-hoo.
All right, okay.
Yeah. Dr. Batomi, I can see you, Sister Nike.
Go one. That is it. I think I
awesome.
Just taking one. Let's see if we can take one more.
Okay.
Okay, hold on.
You.
I'm using. Okay, hold on. Are we ready?
Yes. Sister Tony, I can see your beautiful smile. Thank you. Yes. Thank you very much.
Right,
Thank you so much, everybody, for joining us. Thank you for joining us on Zoom. Thank you for joining us on YouTube. We'll just say our motto now. Please unmute yourself while we say our motto together. I live in love.
I live in love.
I live in love.
I stay in peace.
I stay in peace.
I stay in peace.
I shine my lights.
I shine my lights.
I use my power.
I use my power.
So help me God.
So help me God.
Okay, see us all next week. Thank you so much. Have a lovely weekend. Bye.